today to this session. I know there's a lot of other great talks out there, so I really appreciate you being here. I'm going to start by asking a couple questions. Who here has actually heard of Septris or played Septris? Okay, great. So hopefully by the end of this talk, I'll convince you guys to actually play the game. And I don't mind if you even want to just check it out right now, because I know when I was in the audience, everyone's on their phones or on their computers. You can get onto it very easily by just typing in Septris Stanford, and it'll get you right to the website. And it's actually a free game. You can play anywhere on your mobile device. Best played like with an iPhone or iPad, but you can do it on your Android as well. So who has heard about the Rory Stanton case in New York about a year ago? Anyone? This is a really high-profile case. It was about a young boy who presented to an ED in New York with symptoms of nausea and fevers, abdominal pain, was diagnosed with viral gastritis and then sent home. 2 days later, he came back to the ED and was actually in septic shock and died in their ICU. And they figured out later that he actually had bacteria in his blood, and the source was he had been playing basketball and had a cut in his arm, and actually that was the source of the infection. And the problem was that, unfortunately, the docs missed it. So there's been a huge amount of publicity around this case, and New York has actually changed what they're doing to require sepsis screening in all their hospitals and to report their process metrics for sepsis and their outcomes. So sepsis is very common, and it's everywhere. It's international. And the problem with sepsis is if you don't catch it early and it progresses to septic shock, the mortality is very high, despite getting all the treatments in an ICU. So the International Surveillance Sepsis Campaign is really pushing for early identification and using their best practice bundles for treatment. And using these bundles, they have shown these are early, like aggressive treatment bundles. They can improve the mortality. So I come from Stanford here, a hospital, and sepsis is like the #1 cause of death in our hospital. So there's like a huge amount of attention paid to education for this as well. So I'm part of the Sepsis team, and for years we were thinking about how are we going to provide education for our trainees and our nurses and our physicians. So we had the opportunity to actually get some funding from our CME department to teach about sepsis. So we were sitting there brainstorming, and one of the ED docs in our group was like, well, let's create a game, because everyone's playing games now, and it is just so much more engaging than a lecture. And I actually went to a lecture talking about medical students, and what was really interesting was they were saying that you're lucky if the student remember what you said, about 40% of what you said right after a talk, and 24 hours later, they only remember 20%, and a month later, they remember like 3%. So I think that lectures are a difficult way to really engage people, and how do you engage them? Really in simulation. So Septris is like really kind of cheap simulation. You can play it anywhere, and it's, I think, a good adjunct to your traditional teaching for sepsis, like to your chalkboard talk, or, we do a lot of simulation at Stanford on our floors, but that is very expensive to have the mannequin. You got to get the nurses, you got to get, your the whole team there, and I think that Septris has the opportunity to reach a lot of people in a cheap way. And so what we really try to teach in Septris is the whole different forms of sepsis. Like I mentioned before, as it progresses, it becomes much harder to treat. We want to integrate our best evidence into it, so when you actually play the game, it gets hammered into, hopefully, our best practices. And also really calling for help early. That's basically something that we think in medicine all the time, is like, how do you triage sick patients, and how do you make sure you get their team at the bedside if they're ill? So who's actually trying to play it now? Anyone? Okay. So what we did was, who's heard of Tetris? Yeah, so I mean, one of the people in our group was like, why don't we match sepsis with Tetris? So we came up with this idea of patients actually falling in health, and it kind of gives you like that urgency of, wow, this patient's about to die, they're about ready to hit the bottom of the screen. And I actually found it very effective in like really engaging myself and like, okay, let's triage these patients. This one's kind of nearing the bottom, let's deal with them first. And we decided to go with 2 patients at once just so that you had to kind of juggle two decisions at once. And then we try to make it as interactive as possible so that you can order labs and imaging, antibiotics, fluids, get consults, and then you got immediate feedback on your choices. So like if you did something right, you'll get points for it. We put pop quizzes in there to give you an opportunity to answer a question. And at the end, if they either died or survived, there was a question at the very end to kind of wrap up the case. So that makes it kind of very like immediate. The scoreboard was, because we know everyone's very competitive, so having kind of that in line kind of would make it more fun. And then again, like as I mentioned, the big thing was mobile. So we really wanted you to be able to play it like you're sitting, waiting in line in the doctor's office or a grocery store. You just, spend a couple of minutes and end up doing it. We also wanted to just make sure that we had kind of the basic curriculum there. So we started out, we have like the front page has tips and hints where we put the Surviving Sepsis campaign guidelines on there and a little bit about the game. And then this is the actual game itself. And you can see that Matt is the patient we're treating right now, but Paul is actually more near death. So he's probably the one that you want to take a look at first. We also have the definitions of SIRS and sepsis and severe sepsis septic shock up on the top. We have the chart, which is like the history and physical. And then as you get your labs, they'll come pending on actually on the screen. And we also always have our vital signs actually at the top. Although honestly, I think the visual representation of patients actually falling down is really what draws the attention. And then we have Dr. Sepsis, and I don't know who's at Stanford, but this is Norm Riss. He's the head of our ICU, so he's Dr. Sepsis. And he'll come up and say things like, great job, you did the right thing, and then we give a little pop quiz, like how do you define severe sepsis? And then the other case is when a patient actually is healed. Again, this is really a question to talk about source control, and if you answer that question correctly, you also get more points. So gaming is fun, but does it really teach? So what we did here at Stanford a year ago, actually in this very room, we actually took our medical students who were going into clerkships and had them all play the game. And it was kind of fun to watch them because, often they were actually all like sitting around with the computers and really engaged. And then we actually measured before and after their attitudes and knowledge around sepsis. And we did find that they self-reported improvements in attitude and knowledge, and they did do better on a knowledge quiz. So we do feel like there is a potential of actually learning or teaching about sepsis. So as we move forward, we'll keep on monitoring the data, but honestly, I think the big thing is trying to get it more global and trying to just increase awareness of sepsis. So we've actually partnered with the Surviving Sepsis campaign. They're actually really interested in basically better treatment on the floor. So just last week I was in Chicago and talked about education, how we could use these types of tools, both simulation and gaming, to improve our education. And also, I don't know who was at the posters, but SICO is actually an offspring of Septris, where they're actually teaching surgical decision making in a much actually, I think, a little bit better platform. So we are going to convert Septris to the SICO platform soon so that we can actually have like an ICU mode and actually ask more questions. As I mentioned before, one of our real goals is to make this really inexpensive and anyone can play. And the thing about sepsis is that it is international. So we're really excited that we've had many people come visit the landing site and actually visit the game. And as of last month, we've had 15,000 plays and about 3,100 people have actually finished playing the game. So it's about 8 patients that you have to go through. This is SICO, as I mentioned before, and it is on a slightly different platform. The advantage of SICO is that it can actually record the order of the choices that you make. So I think this is going to be really powerful for education and really understanding clinical decision making of why someone may choose one thing based on their first choice in the order. So we're really excited about moving this platform for Septris so we can also study the decision making of our learners. So I want to thank that this was really a multidisciplinary effort, and honestly, I had no real knowledge of creating a game. So we partnered with our folks in education technology, and we hired a programmer to actually program Septris. But it's been a really rewarding experience, and we've had lots of fun with it.